It's been a while. It's been a couple of years, in fact. And some things have gotten better, and some things have stayed the same, and some things are really discouraging. So, little background. We need to talk about some stuff. Mostly we need to talk about vaccines. And I'm tired of censoring. Vaccines. Take the algorithm, do whatever you want with it. I'm not going to say the V word. I'm not going to say the poke, the jab. Vaccines. Let's just say it right out in the open. Okay. So let's go back to the year 2006. I have my second baby. And my first child was a year and a half, almost 2, when she was born. And starting to show some developmental delays. I am making no claims about why. Even to this day, he's now 19, making no claims about how or why, but they do exist. Those are a fact. And I have this natural birth in the hospital. I get to the hospital and she's born about 30 minutes later, which of course will spark my whole, what did the hospital even do for me? Maybe I should have home births from now on. But I wasn't questioning everything yet. So they're doing this intake as I'm deep in labor, and they're saying, do you want her to get the hepatitis B vaccine? You can also get it at her first pediatrician appointment. And I just kind of said, yeah, whatever. Now, of course, they didn't ask me about the vitamin K shot. They don't tell you about that. They didn't ask me about the eye ointment. They don't tell you about that. They just do it. But whatever. I just went forward. She got the shot. She got both shots, in fact. And we were seeing a family practice doctor at the time. I brought her in at 2 months and got her the normal 2-month shots, which is another hepatitis B, a DTaP, a polio, Haemophilus. I'm not sure whether they get Prevnar yet or not, but... And things seem to be okay going forward. My other child didn't need any. He was good for a couple of years at that point. We never did do flu shots. So those weren't on our radar. Then I brought her back at 4 months to get the next round, which is pretty much the same thing that they get at 2 months. And she spiked a fever and screamed for 3 days. And I started wondering. And of course, everyone just waves it off and says, oh, give her Tylenol, she'll be fine. I know it sucks, but that's how it is. Just give her Tylenol, she'll be fine. Well, in between 4 months and 6 months, I had a complete revolution. In that 2-month span, which is the summer of 2006, I met some people who blew my world open. At the time, I was exploring home birth and how people still did that, and I didn't even know where to go to find information about that. And that's a gateway drug. That was my gateway drug. It opened up to everything else, including the vaccine question. And then I started connecting the dots about how she definitely had this reaction at 4 months. And my other child, who knows? Maybe that's why he was so speech delayed and why he's showing signs of autism. Maybe. Again, I'm still making no claims about that. I am saying it got me wondering. But in that time, I didn't feel confident enough to say no at the 6-month appointment. I also didn't feel confident enough or even really consider fully that I could have just canceled that appointment or put it off. I didn't know. Well, I brought her in and did the whole cursory exam, and yep, seems like everything's fine. Nurse comes in, she's got 3 syringes on a tray, and she sets up a couple of Band-Aids so that they're all ready to go, and she pins my baby against the exam table with her body, and she goes, shot, Band-Aid, here's your baby. And of course she's crying because that's what they do. And then the nurse turned around and said, oh, whoops, one of those Band-Aids stuck to me instead. And so she puts a new Band-Aid on, and I look down, there's a little spot of blood on my shirt. So I load her up in the car, and I start driving home, and I remember the intersection where I stopped at a red light, and this weight settled on me. I had my child's blood on me. So now was the time to dive in and figure out what I actually had to do, what this whole thing was about. Look beyond the one-sided sheet of paper that they hand you after they give you the shots. There was no informed consent on any of them. I started reading. I downloaded a copy of the CDC's Pink Book, and I wish I hadn't gone through so many hard drives since then. I wish I had saved that copy because I know it's been revised a bunch of times since then. But I read it cover to cover. I read all the package inserts. I did read a couple of books. I read Stephanie Cave's book. I read Neil Miller's book. But mostly I liked the dry clinical, here's what we know. Although if you know how to read it, they aren't as dry and unbiased as they like to say they are. And I felt pretty confident from then on to say, we're not getting another one until some things change. For instance, why do you keep calling it a tetanus shot? It's not a tetanus shot. There is no tetanus shot. There hasn't been in decades. It is always combined. It is inextricably combined. At the very least, you are getting tetanus and diphtheria. And most of the time, you're also getting pertussis. So why do you call it a tetanus shot? Wouldn't that be lying? So I was done. And it wasn't really much of a challenge. I did find a new pediatrician, and she was supportive, and we went forward. Then I got pregnant again. And the home birth plans went out the window at 26 weeks when I had a placental abruption. That baby spent 99 days in the NICU. And guess what? They don't alter the vaccine schedule for preemies. The only thing they do is if they're born before a certain time frame, and I don't remember exactly what it is, but I want to say 30 weeks, then they give the birth dose of hepatitis B at 30 days. Why? No reason. It's all arbitrary. But they don't give it to a brand new 1 or 2 pound baby when they are that premature. But we kept going. So at that 1 month time frame, overall he was there for 99 days. At the 1 month mark, they said, let's do the hepatitis B. And I said, no, thank you. Didn't make a big deal out of it. I didn't argue. I just said, no, thank you. And they said, oh, well, we can get it again at 2 months. 2 months rolls around. Mind you, this is still 1 month before he should have been born. He should still have been inside my body for an additional month at the time that they were calling him 2 months old. And they want to give him everything that a 2-month-old baby gets. All the same shots that my other 2 kids have gotten. Combine whatever it is. They wanted to give him all those same things. And I said, no, thank you. And they had those vaccine information sheets right there, and I guess I went home without them. And the next day, our primary nurse said, the doctors are really concerned that you declined the vaccines without taking without looking at the sheets. I said, all right, give me the sheet. Now, what's on this sheet that's not in the Pink Book? And she said, you read the Pink Book? I said, yes, cover to cover. What's here that isn't in there? I said, I've spent more time on this question than I have on my master's thesis. I'm comfortable declining these vaccines. And I will give them credit. They left me alone. That was 2008. I don't think they do that anymore. He is still vaccine-free. He was my first vaccine-free child. Well, in the 17 years since my daughter was a baby, I haven't spent continuous amounts of time studying this topic, but for sure, I have spent thousands of hours studying this topic, learning new things, talking with all sorts of practitioners about it, including doctors, including pediatricians, including virologists, and I am comfortable with the paradigm shift that I had in the summer of 2006, where I first met these people and said, wow, why wouldn't you vaccinate? Why would you? Whoa, wait a second. Why do you take a body and say, we can improve on it? On a mass scale, every child that is born, we say, God screwed up, or if you'd rather, evolution screwed up, and this body was born deficient, and we can make up for it. How arrogant is the human race that you think you can intervene on a global scale? And you know enough to do that? You know enough about physiology? You know enough about the biome, the whole ecological biome? How viruses and bacteria are in the environment and how they interact with each of us? And you think you can eradicate some? And what does nature do with a vacuum? It fills it. And we have co-evolved with many of these pathogens, and removing them from our development, what effect does that have? You didn't ask that question, did you? So here we are, and we have just gone through 3.5 hellish years where vaccines as sacrament and as baptism has reached, pardon the pun, fever pitch. And it's not getting better. Now, I'll grant you some people have come around, but it still shocks me that we're treating this so casually. Oh yeah, of course I'm going to go follow my doctor's orders. Your doctor can't tell you the truth. Pharmaceutical companies funded their education, and they continue to fund the hospitals that are their employers. They can't tell you the truth. The FDA has enough evidence to pull these vaccines off the market. And when the head of the FDA goes to be the head of Merck or Pfizer or Eli Lilly and back and forth, what incentive did they have to hold vaccines to the scientific standard? They were grandfathered in starting in the mid-20th century when we had a frankly lower standard. What incentive does anyone have to tell the truth? They have incentives not to tell the truth. So I know a lot of people, I've met a lot of parents over the years who skip vaccines, and most of them will say, we just want choice. Right? I used to be there. I used to say, I'm not living in that person's body. I'm not living with that person's family. I'm not making decisions for them. I don't have to live with those decisions. They can do that. I'm past that now. I am not pro-choice. As long as we have an FDA, we might as well use it. We might as well hold all drugs to the standard, to the same standard. And that's why they call vaccines biologics. They don't call them drugs. But as long as we have the FDA, we might as well use it. I am not pro-choice. Pull them all off the market. Stop intervening on a mass scale. Go back and learn why physiology is the way it is before you go mucking about with every single child who is born. There. So that's why, long before 2020, I wasn't ever going to take a COVID shot. And when they came out, I saw that they were never designed to stop infection or transmission. I saw that they had the same problem with the acellular pertussis portion of the Tdap vaccine. They were never going to do that. So I was pretty comfortable saying, stick my cold stiff arm. Still comfortable saying that. And I will go to great lengths to make sure no one in my family ever gets it. once you're making your own decisions, you know what? I can't stop you. But I don't have to cheerlead you. I do not have to cheerlead you. And I will advocate that the FDA actually do their job and pull them off the market. Because it is time to remember that we don't know everything. And when you don't know everything, you err on the side of default, which is everyone was born unvaccinated. Until you have all the evidence, you don't intervene. There. Said my piece. Take it or leave it. I am not pro-choice. I am anti-vax. There. I said it.